What's up, everyone? Today we are going to talk about the menstrual cycle. Now, to continue our series on how that affects sleep, today we are going to talk about more specifically days 1 and 5, which we all know as menstrual cramps, other words known as dysmenorrhea. This is kind of the pain and sleep gap that we oftentimes have during our period, which can cause issues with being comfortable and falling asleep. So today we are going to talk about the causes of dysmenorrhea, the symptoms of it. Also, are there any things that we can diagnose and rule out so it's not other issues that are causing this type of pain and discomfort? And then we can talk about lifestyle modifications on how to improve the dysmenorrhea and also lessen the intensity. And then lastly, are there any supplements and herbs based on what we've seen that's been helpful for these types of menstrual cramps? So as we start this, we all know the menstrual cycle. It's day 1 through 5. You can kind of see a faded square on this PowerPoint, but that's the start of your cycle. Typically, estrogen and progesterone reset to baseline. And as the period ends, estrogen will start to increase. Now, what this is doing is allowing those follicles in our ovaries to mature so we can produce an egg right for ovulation around day 14. Now, with this, during that period cycle, we can have what we call menstrual cramps, which is not very fun. A lot of times, you'll have these intense cramps in the lower abdomen, and it really hits the energy levels. So with something like that, what you can feel is that dull, throbbing pain throughout that lower abdomen, but it also has been shown to really radiate towards the back and inner thighs. But they say here, around 50% of women will actually have this kind of discomfort. But that's not just localized to those areas I just said. Look down here. You can have backache, headache, nausea, vomiting, dizziness, loose stools. I mean, really just things are just out of control with discomfort, pain, which can also affect the gut. Now, as we look through the causes of this, most of us will see it in primary and secondary. Now, secondary dysmenorrhea is secondary to something like endometriosis, infections, ovarian cysts, things that we really want to do research and make sure the doctor rules out. So if you feel like you have this and it's very intense, go see your doctor to get them to look into these secondary causes. However, if none of those are positive, which is great, then you could just have primary dysmenorrhea, which is the cramps without the absence of disease, which can give us other things to look into as it relates to lifestyle. So when you look at primary dysmenorrhea, what we've learned is that it is something related to prostaglandins. This prostaglandin that I have here, PGF2 alpha, really stimulates the contraction of those uterine muscles, especially around the time of menses. And this can also lead to vasoconstriction, uterine ischemia, and painful uterine contractions. Really, it's that last one that we typically will see. It's just everything feels discomfort, and that type of discomfort can also radiate to the back, to the legs, as well as, making you feel very sick at times. Now, when we look at this, the greatest release that we've seen of those prostaglandins is those first 2 days. So you'll feel it. You'll just be miserable, more irritable, less sleep. So that's something that if you notice, it's very important to carry a diary for your menstrual cycle. So you can start calculating these symptoms as it relates to day 1, which is the first start of the actual period, not spotting, but actual the first full day of your period. Now, when it comes to this, the high prostaglandins have been associated with low progesterone levels. So this can tell us, closer after ovulation, closer to like day 19 and 20, we could potentially do some form of hormone checks, saliva, urine testing to see if your progesterones are low. Now, as we look into diagnostics to rule out dysmenorrhea, remember, I wanted to tell you secondary dysmenorrhea is something that we still want to rule out if this is intense and you're really feeling it, because you can have primary and secondary as it relates to these types of things. So one thing that your doctor might do is order an ultrasound just to see if there's ovarian cysts. They might do a pelvic MRI. If an ultrasound is inconclusive, they can do a laparoscopy, which is basically just to rule out any type of endometriosis. And then also sexually transmitted screenings, right? I mean, we can't rule those out, especially if you're sexually active. And then lastly, a CBC with differential. I mean, really just to do an overall blood count to see if there's any other irregularities that could be happening. Most of these that you see here are typically covered by your insurance, unless you're in those high deductible plans, then you're just paying regardless. Now, when we look at some of these to really rule out that primary and see what the issues are, these tests typically are rarely covered, but we can see these covered by the HSA benefit or FSA if you have those for those high deductible plans. So a lot of times people or functional medicine doctors will do something called a Dutch test, which they get your urine, they dry it out, and they do a bunch of tests to see not just what hormones are active and what amount, but also what type of metabolites are coming out of those. Another one is organic acids, really just to show what is going on with those metabolites more in detail. And then, of course, comprehensive stool tests, making sure that the gut is not a big issue of more estrogen recirculating in the body, as well as other things that can recirculate when your gut isn't activating or working as properly. So those are three common things that are useful and kind of diving into that. But here are some dietary things to help reduce the symptoms or the intensity of dysmenorrhea. Now, one thing it sounds pretty, common sense for most healthcare providers is eating breakfast. A lot of women will skip it. It's inconvenient. A lot of my moms out there are in a rush. They feed the kids, but they don't put anything in their body. And before you know it, they're starting to feel that empty stomach, a lot of stress coming because of that. So if you are going to eat breakfast, really focus on lean meats, healthy fats, and complex veggies. Of course, starches are good too, like sweet potatoes or full potatoes, but you really want to focus on those three foods in your belly first before you do anything starchy related or juice related. The last thing we want to do is put coffee in our body, and that's it, because your body is so primed to absorb anything at that time that it can be very shocking and cause you to go through this whole cortisol roller coaster all throughout the day. Now, the next thing that we've seen was eating a diet just high in vegetables. If you can imagine, a lot of the vegetables have soluble and insoluble fiber. This fiber allows our gut to really absorb a lot of these excess hormones and allows us to just package it up nice and neat and right through the toilet. So one thing about diets high in vegetables is you get really good gut function. Now, we have seen data on this third one that says try to avoid gluten for at least 90 days. It takes your gut a while to repair itself as it relates to, getting the full benefit of being gluten-free. But just know that there's gluten in a lot of other things. So really avoiding processed foods and breads can help eliminate it. But if you are extremely sensitive, you might find that it's just you need to make sure to really give yourself enough time before you can actually see the benefits as it relates to those menstrual cramps or those other symptoms. Now, aspartame, we see this as kind of a sweetener in a lot of diet Cokes and diet sodas. So obviously, this is something that's just not normal to our system, but can cause it to just be more intense. Now, not all people are going to be affected by gluten, aspartame, so don't feel like across the board I have to give this up because Dr. Zeke said so. Just remember, these are some things that we've seen in certain types of research that has shown to lessen the intensity of a lot of the dysmenorrhea symptoms. And then, of course, the last thing that we can look at are just checking food allergies or food sensitivities. Sometimes foods can cause histamine to increase. Now, if you're curious on what type of foods can cause more histamine to be released in the body, or they actually carry histamine themselves, or they can affect the excretion of histamine. Try to Google those words and you can see a lot of things pop up. Things typically that are more fermented or they take longer to cook, they'll have more histamine. So you have to try to look at that too. So those have all been some things that we have seen in the past. Now, the next thing I want to talk about is what are the nutritional therapies or supplements that we can sometimes use to really help us out. Now, first and foremost, calcium. We hear that it's so important for our bones, but we don't really take into consideration we need calcium to contract our muscles. We need calcium for our nervous system and so many more things, so many more reactions that go on in our body to produce things. So one thing that we've seen is in a double-blind study, it showed a reduction in cyclic uterine pain when we are taking a good amount of calcium. Typically, you want anywhere from 1,000 to 2,000 milligrams. Now, you want this in divided doses, typically between 500 to 600 milligrams, no more than that. Your body just gets rid of it through the gut. Now, another thing that we've noticed is iron levels. When iron levels are extremely low, we notice the pain has been even worse when it comes to those menstrual cramps. So really making sure your doctor can check iron levels, those are always covered, but make sure if you supplement, it is with a chelated iron. A lot of the iron that you get out in the grocery store typically doesn't have good absorption, and it has a lot of side effects as it relates to stomach cramps, discolored stools, and so many other things. So I really want you to look for a chelated form. You can get them at GNC. You can also click down the link below and I can send you some supplement recommendations if that is you. I definitely don't want you taking iron if your doctor has not checked your labs. The other ones that we've noticed, magnesium. I like mine in the form of magnesium bisglycinate. Glycinate is fine too, typically around 300 to 600 milligrams per day. I divide mine in doses. But iron's a cofactor in what they call delta-6 desaturase. So that's involved in anti-inflammatory prostaglandins. It also has that relaxing effect on the skeletal and the smooth muscle, like in our uterus. So with this, I've noticed when you can use magnesium with vitamin B6, so if you're already taking a B complex, that means it has multiple B vitamins in there, you'll notice a more uptake of that magnesium into the cells, so into your smooth muscle, into everything else. So really magnesium with vitamin B6 is a huge benefit for your body. So if you are taking a B complex with magnesium, even better for you. The next thing is omega-3s, typically around 2,000 to 3,000 milligrams per day. If you start to go above 3,000 and you're on something like aspirin or a blood thinner, you do want to be careful because anything above 3,000 milligrams can start that blood thinning effect. Now, that's most people. It could be 1,000 for you. We just don't know. But start with 1,000, see how you do. Work up to 2,000, 3,000 milligrams is typically safe for normal people. Now, vitamin D3, just like your iron levels, you want to check. You want your vitamin D3 levels at a good range. Now, with that, vitamin D3 is also going to help you absorb calcium. So you have to remember that. A lot of people have talked about using vitamin K2 along with your D3 just to get it out of the way. K2 grabs calcium from the arteries and pushes it more into the bones. So keeping that calcium out of the arteries is key. We want it to go places. We don't want it sitting in our arteries so it can calcify. So if you're not on a blood thinner like warfarin or anything else, make sure vitamin D3 and K2 are in your supplement. If you have any questions, if this is right for you, always reach out to your doctor and just discuss these recommendations. Remember, all of this, what I'm discussing, is educational purposes only, and it's not to override your physician. Now, the next thing I look at is vitamin E, 150 to 500, really starting 10 days before your menstrual cycle. And then you kind of carry it through day 4, so a day before your period ends. This can really help with some of those symptoms as vitamin E does a lot of things in the body. And then lastly is zinc. Zinc is super involved when it comes to all your hormones and how your hormones work. And if you look up in Google what foods are high in zinc and those are not on your list, you might want to try to supplement anywhere from 10 to 15 milligrams. And if you can find zinc and copper together, typically, if you take them together, it keeps things balanced. But if you only take zinc without copper, things can start to fluctuate. So that's something that I really want to make sure you're aware of, is that zinc and copper at that ratio of 10 to 1 or 15 to 1 is typically recommended from a lot of functional medicine doctors. Now, we like herbal medications, but let's not fool ourselves. Herbal medications are very much like medications. They do interact with medications. They do interact with your liver and everything else. So if you are going to start an herbal therapy, you definitely want to make sure your doctor is aware that you are thinking about starting this, or your pharmacist, so they can do any type of drug interactions. For example, black cohosh. Typically, I'll have somebody do this 20 to 40 milligrams twice a day. And there's a certain version that's like a standard extract. And we will start this before menses, right? Now, black cohosh, it's called a spasmolytic and an anti-inflammatory because it helps smooth out, helps to smooth and skeletal muscles. But if you are taking Tylenol, Lipitor, or something for like arthritis called methotrexate, these can interact with black cohosh because it's directly working with the liver and doing all those things. So you want to be very careful if you are taking, let's say, aspirin, because you might have discomfort and you might be taking an over-the-counter medication that has three things: a diuretic, some Tylenol, as well as some other things that they put in it. But you to start taking black cohosh, you might be at risk for some drug interactions there. So make sure you're talking to your doctor as well as your pharmacist so we can check those drug interactions. Now, there's another one called Dong Quai. This has actually been used since like the 16th century, but it has analgesic and anti-inflammatory properties. Now, this is used typically with other herbs, but regular use could make this menstrual cycle heavier. So I always say, use this sparingly. Like if you're having a really bad time, take something with Dong Quai. But if you notice you're always taking this and your menstrual cycle flow is really, really heavy and picking up, we might have to just take this off temporarily. Ginger. Ginger is great. It's an anti-inflammatory agent, especially with dysmenorrhea. And it also helps with nausea. So if you're thinking like, I'm having some stomach issues, taking ginger, it has been shown to be almost as helpful as an NSAID like ibuprofen. But you do have to take around 250 milligrams 3 to 4 times a day, kind of starting 2 days before the cycle. So like on day 26 and then at day 3. So you're like 3 days into your cycle. So you can really stack up on these and use them throughout for months. And then the last thing I like to look at is, are there any teas that I can drink? Herbal tea is great. A lot of times very minimal interactions, but there are some that do interact. But one thing that I like doing is chamomile. It's antispasmodic, it's anti-inflammatory due to all the flavonoids that are inside of it, but it does have sedative qualities, so it can help kind of calm you down and help push you into a nice sleep when you're having those troubles. Now, this does work with dysmenorrhea that also has diarrhea, bloating, and gas. Now, this can also help with when you're feeling irritable and more anxious. So just kind of, pour a tablespoon of this with about 1 to 2 cups of hot water. Let it simmer for 10 to 15 minutes. Drink it slowly. The other one is cramp bark. Literally, the effects are in its name, cramp. Now, this is typically used with caution with things like diuretics or if you're on lithium. But this is a uterine antispasmodic, and it can be used for pain, dysmenorrhea, amenorrhea, which is absence of menstruation. But, the mechanism of this is unknown. I don't typically use cramp bark. I typically will just stick with chamomile. And if they're not on any medications that interact with black cohosh, those are kind of my two. But if they're up for ginger, we can do ginger drinks as well as many other things. Now, one thing I do want to talk about is supplements. You kind of get what you pay for. You go to the grocery store, you want to get 3 bottles for the price of 1, and you look at your labs later to see if your iron is up, and lo and behold, it's still right there, low as normal. I typically will use a wholesaler called Full Script. These are typically for doctors, nurses, pharmacists, practitioners, really people that are, wanting to give you a high quality product that has been vetted out, meaning they are creating the product correctly. They are making sure they're being tested for heavy metals and other things that can harm our bodies. So if you're interested in supplements for these menstrual cramps, as well as a foundational kind of what supplements should I be taking just in general, I'll have that link below so you can take a look at that. I look at foundation supplements, I'm looking at just 4 things. I mean, we could probably say 5, but in general, you're looking at a high quality multivitamin, which I use Alpha Base for myself, my family, my friends, my colleagues, my clients, anyone that's asking me which one can I have. And you have to be a practitioner to recommend some of these. So this is why I use Orthomolecular. I've talked to the company, I've seen their facilities, and it is just top notch no matter what you do. So Alpha Base is kind of that multivitamin that covers a lot of those gaps in between your therapies or in between your food and things that you're not getting. So I really like to focus on something. This one is 4 capsules a day. So I normally do 2 capsules twice a day with food. The other thing is vitamin D3 and K2. Since my D3 levels can change so much, I typically will take it in liquid form. 1 drop equals 1,000 vitamin D3 international units. And what I'm doing there is allowing my body to be able to absorb calcium as quick as I can. The last thing, or the third thing, is magnesium. Magnesium is so important because we are all undernourished when it comes to magnesium. Our foods don't contain as much magnesium, and you need magnesium for over 300 enzymatic reactions in your body. So I typically take a scoop with water, shake it up, and I'll drink that every night. And my Alpha Base has a lot of vitamin B complexes, but I also sometimes will take a B6 by itself or take a B complex as well. But if you can afford Orthomolecular's omega-3s or just a good omega-3 supplement, remember that's anti-inflammatory, that's good healthy fats, not just for your brain, but just anti-inflammation all throughout. And that would be the next thing that I'm looking at, really helping to take that, reducing the inflammation, as well as, those symptoms that could occur. So most people ask me, what kind of supplements can I try when it comes to this? Now, in my full script, you can see something by NFH called Black Cohosh SAP, which is kind of PMS support. But this is specifically Black Cohosh from Actea racemosus. Now, 1 capsule is about 40 milligrams of the extract version of Black Cohosh. Now, typically you want to work your way up from 40 milligrams twice per day. But I will typically start with like 1 capsule that first day and just kind of see how I react to it. I do want you to check with your doctor on this because it can react to Tylenol, Lipitor, which is a torvastatin, carbamazepine, which is common for a lot of trigeminal neuralgia pain, pain on the side of your face. It's also common for a lot of seizures, and then methotrexate. So if you are taking those, please consult your doctor before you do any type of herbs like Black Cohosh. The next one in full script, this is called Gabinol. Now this has vitamin C, 40 milligrams, vitamin B6. Remember, we want that B6 in there, 50 milligrams. Typically 100 milligrams is kind of what we're looking for, but 50 milligrams is good. Magnesium malate. Now it doesn't say glycinate, but it says malate. That means it's helping to push magnesium into the muscles like the smooth muscles as well. Then we have the GABA. GABA really helps to relax the body just in that peripheral zone. It doesn't really cross the central nervous system, and it's not, something that I would say we absolutely need, but it can help. The next thing is glycine. This helps to cool down the body and really get it ready for sleep. And then of course that Dong Quai, right? It has about 150 milligrams, and remember that's the one that works as a muscle relaxant, and it has that analgesic anti-inflammatory effect. But with that, like I said, with anything with Dong Quai, I don't try to take it consistently. So kind of around your menstrual cycles, maybe 2 to 4 days before. Day 3 is kind of when I stop it, especially if the symptoms is already getting better. But when you look at other things, there's conventional therapies, as we know. We can put heating pads. I haven't used TENS unit, but that was in the literature, and I felt like, okay, if you or your chiropractor or your functional medicine doctor can kind of consult you better on how to use TENS units around those areas, what type of frequency and things like that. But we always see acupuncture as a way to help with pain, discomfort, anxiety, and so many other things. And then something that's just last on my list are conventional therapies like NSAIDs. Oral contraceptives can be beneficial if you're just looking for a quick fix, something covered by insurance. Just know there are a lot of deficiencies that occur with oral contraceptives, meaning that vitamin B6, which has so many uses in the body, it can really start to deplete, and you can start to see these types of symptoms appear shortly after starting oral contraceptives. And then, of course, we have pain medications. But this has been really cool to kind of dive into. Please post your questions down below. If you're looking for a link on supplements, look down in my full script. You can kind of sign up under me, look at the whole catalog to see what other supplements are available. And if you're looking for the ones specific to my foundations, I can send you that link so you can have those and pick which ones you're looking at. But next series, we are going to go over something extremely common for women that typically after kids or later on in life, they'll start to feel these different symptoms coming later in their period. It's called estrogen dominance. We're going to talk about that, as well as some estrogen superchargers that are in our environment that cause us to feel like we are being taken over by estrogen. So I know this is a long-winded video. I hope you learned something. If you have any questions, shoot them down below. I'll be happy to help. Dr. Zeke, pharmacist and adult sleep coach. And like always, please consult your doctor before you do anything. This information is only educational purposes and it does not replace your doctor's information. So please use this wisely and send me some questions if you have them. Have a great one, guys. Take care.